am Dr. Peregrino, and I'm the host of Entre Nosotras, Latina Voices. Today, we're going to be joined by Dr. Jessica Chacon, Laura Renovato, and Karina Becerra, who work for the El Paso HEAT program. Dr. Chacon is also a faculty member at the Texas Tech Health Science School of Medicine here in El Paso, where she's a professor of immunology. And so we're going to be joined by some of the community health workers in a little bit. So Dr. Chacon, could you tell us a little bit about where the practice of using community health workers comes from?
Yes, so community health workers, or Promotoras de Salud, they're trusted individuals who really use their communication skills to collaborate with the community. So they serve as liaisons between the community members who primarily speak Spanish and may be from low-income communities, even colonias. So they serve as liaisons between those communities and the healthcare field.
And when I was thinking about the tradition of healthcare workers, I mentioned that historically, sometimes the U.S. government has done unethical things, so there could be some distrust between the community. Could you talk about the Tuskegee syphilis study and how maybe that leads to distrust among African Americans with government and with healthcare?
Right. So there can be a lot of mistrust with healthcare providers, with researchers, with scientists in the community. The Tuskegee study was a study done on syphilis in African American men. It was not ethical study, so they did not provide the researchers did not provide the appropriate healthcare that the individuals needed for quite some time. So the syphilis went from the primary early stages to ultimately tertiary stages, which can affect the neurological symptoms. So that did build a huge bridge and mistrust between the community and the healthcare professionals. However, since that time, there's been many regulations and steps to ensure the safety and efficacy of any research study that's done, as in academia setting, in pharmaceutical settings. So we've really tried to build that trust again. And the promotoras, or the community health workers, they come into play because, as I mentioned, they serve as liaisons. So you might have some individuals, maybe there could be a language barrier because predominantly in El Paso is the Hispanic population. So many individuals speak Spanish only, or Spanish as their first language. So there might be a language barrier between the community and the healthcare provider. So the promotoras can serve as liaison, providing this health education to the communities, and specifically in Spanish, and also help the healthcare providers improve that trust.
You know, I could see where sometimes a doctor might use very technical terminology, and so it'd be nice to have somebody that can explain it in language or terms that people are going to understand.
Yes.
And so I also wanted to ask you while we have you, tell us a little bit about the EP HEAT program and what its mission is.
Yes, so I am a native El Pasoan. I'm very proud to be from El Paso. I moved back to El Paso 2 years ago after 15 years of being away at school and graduate school. So when I moved back to El Paso, I really wanted to help my community, but I knew that I needed to do this in a safe manner. As a faculty member at the Paul Foster School of Medicine, I wanted to include our medical students. So what I did is I created EP HEAT, which is El Paso Health Education and Awareness Team. So what EP HEAT's mission is to provide health education material to the community. So our students are going to serve as the educators to the community, answering any questions that the community members might have, and then faculty serve as moderators and support for our students. And it's very hard because faculty and students at the med school were used to using medical and scientific jargon. So trying to convey that same message into lay term it's very, very hard, but it's incredibly important for our students to learn this early, and that way they could be better communicators to their patients in the future. So EPHEAT provides our students an opportunity to serve as educators for their community. We provide English and Spanish workshops on COVID-19, on diabetes, on dispelling myths in healthcare, but our promotoras are also a part of EPHEAT, and the promotoras are the experts in communicating with the people. So I've asked our promotoras to also train and mentor our students on really how to effectively speak to the patients, speak to the community, listen to their questions, and talk to them in a later manner that the patients are going to understand.
As somebody who visits doctors on a regular basis, bedside manner is so important. So I'm glad that through this program, you're having future medical students learn from the promotoras how to best communicate with their future patients. So that's wonderful. So I don't know if there's anything that you want to add before we interview the promotoras.
No, I just really want to thank the promotoras for being on our team to be receptive to training and mentoring our medical students. We have 4 promotoras right now on our team, and each of them has really provided an instrumental part on EPHEAT.
And I know they'll be sharing some of the projects that you have done this year, and hopefully will continue to do so. So kudos to you for starting EPHEAT and having the foresight to just in time for a pandemic. We need the information and the resources out there. So thank you for all that you do.
Yes, thank you. Thank you for having me.
Today, I'm being joined by 2 promotoras, Ms. Laura Renovato and Ms. Karina Becerra, who represent the El Paso HEAT program, which is a part of Texas Tech Health Science Center, El Paso. And they will be joining us and discussing a little bit about the programs that El Paso HEAT does and what they do as promotoras. Welcome, ladies.
Thank you.
Thank you. So let's go ahead. And get started. Tell us a little bit about your background and your current positions.
My name is Laura Renovato. I'm a certified community health worker or promotora de salud certificada by the state of Texas. I graduated from El Paso Community College since 2001. I've been working in the community of El Paso, Texas since 2003, covering most of the rural areas by connecting vulnerable people to social services, educating and promoting good health overall. I'm currently working for Texas Tech EPHEAT under the direction of Dr. Jessica Chacon, and we provide information about COVID-19. We help the Microsoft online classes, especially for people that they don't have a job.
Thank you. And Ms. Karina, do you want to answer the same question? Tell us a little bit about your background and current position.
Yes, of course. Well, my name is Karina Becerra, and I'm community health worker. I'm graduate in Familias Triunfadoras, and I have 3 years of experience to work with the community. And I work in Project Vida. They are non-profit
organization,
organizations. And then I have a lot of experience with the people because I work with different programs. Some of these is the project with COVID too, something like Laura. And the others programs is, to help the community to take many necessities that the people needs.
So ladies, how did you first become interested in becoming a promotora?
Well, when I learned the role of promoter, some of my qualities were is education and to help the community. So, and then I decide to take this career because it's something that that I always do with a lot of passion and love. And then this is the reason that I decided to take this career.
No, that's wonderful. And what type of training did you receive to either at Texas Tech Health Science Center or in your previous studies to become a promotora or a health promoter?
Okay, the first thing it was to graduate uh, the community health worker and maintain my community, my continued education in various issues that that in the some way impact to the community.
Laura, could you tell us a little bit about your the training you've received to become a promotora?
Of course. Well, first of all, let me tell you that I attend El Paso Community College back in 2000. I took some classes to become a community health worker, and then I graduated in 2001. And since then, I've been taking different classes, workshops, attend conferences that offer CUs or continuing education credits to renew my certification every 2 years.
Okay, so it's a community health workers a license from the state of Texas.
Correct.
Okay, good to know. And I know you've already mentioned some of this, but tell us about some of the programs that El Paso Heat is doing right now in the community. Could you elaborate a little bit about the vaccines or the tutoring program that you're doing, or any other COVID events that you're taking part in?
Sure. Let me tell you that I've been participating in COVID-19 events here at Texas Tech. I participated in the one that is for the migrants in San Elizario, and also in the one at Tornillo for the maquiladoras in Juarez. And we also participate in the Microsoft Turing online classes, especially for community members that they need a job.
So for those programs, you're just helping or encouraging the migrants to get their vaccines, or is it other health stuff as well?
Basically, we give information and we also create like a care package with information about COVID-19 and coloring books for the kids. So basically, it's what we do, give information about COVID-19, but not necessarily to encourage them to take the vaccine because they're already there to take the vaccine.
Okay, so just more information about side effects or why it's a good idea to take it. Okay,
Correct.
and both in English and Spanish, the
Correct.
materials.
Yes,
And
bilingual.
how was it with the maquiladora workers in Juarez? How was that? Or they came in from Tornillo?
Yeah.
Through Tornillo?
Yes. And basically what we did over there, it was the same, just give information about COVID-19 with the care packages and help a little bit in case that they need anything else, any kind of other help that we can help them, because it was
And
a lot of people.
approximately like how many people?
I think a day it was 3,500.
Wow.
And a day.
A day.
Yes. And they did that for a complete month.
Wow.
So
that's
so it was in total like 35,000 people. that get vaccinated.
Wow, that's wonderful. Wow, that's amazing, because that's a lot of people, and because we have more resources here, they probably would not have had that opportunity had Texas Tech Health Science Center not worked with them. And we are a bicultural community, and they're supposed to open the bridges next month again to tourists. So that's a good thing that at least they'll be vaccinated. Or I don't think they can come in if they're not vaccinated. So that's good for us if we're getting some of those shoppers. And tell us a little bit more about the program with for the people that are looking for employment, for jobs.
We offer tutoring online classes for the people that were affected by the pandemic. What we do is that we got a grant from Microsoft, and we offer the tutoring classes, especially once a month here at the campus. We have a lot of people, so we have a good turnout. We already finished with all the computers that we received, so a lot of people took advantage of that.
So they're learning how to use, have improved their computer skills for job purposes?
Correct.
Okay. And could you tell us what type, so has it been difficult to work with people, or have in general people been receptive? Have they been open to the vaccine?
With some people, it was easy to help with them, but of course, not with all the people is the same. And sometimes when I get people that they are hesitant to take the vaccine, what I do is just encourage them to take the vaccine by providing facts about COVID-19, and also by creating self-awareness and empathy for other members of their family.
If there's somebody watching the show right now that is still having doubts about taking the COVID vaccine, what would you tell them? If there's somebody in the audience watching that's still like, I want to wait, or I'm not sure, what advice would you give them?
Like I told you before, I will be trying to encourage them by giving facts about COVID-19, because sometimes there's a lot of misconception about the vaccine, and also just to create self-awareness and empathy for other members of their families, because sometimes they don't want to do it, but they need to think not only about them, but about the members of their families.
So there you're talking about the elderly, since a lot of people that are older tend to have worse results with COVID-19.
Correct, and especially
the elderly and children too, since many of them were not being able to take the vaccine. So no, that's wonderful. I'm glad you're doing that work. I'm really impressed with. I didn't realize the amount of outreach you were doing with the maquiladoras. That's fantastic, because that's they're working in close quarters, and so that way they're going to be safe when they're at work. What other projects or events do you guys have planned in the near future?
Okay, well, we will continue to the tutorials, then different topics, until to December, and that is supported by Microsoft, and then we have many tutorials for the people, for the community.
And so, like, what type of tutorials do you guys do?
Okay, the last one that we have something like to find jobs in workforce, comes to give the people a tutorial to how to make or how to looking for the jobs in the internet. And then this is the last capacitation that we have, the people.
No, and that's important because so many people, you know, I'm almost 50, and so I grew up with computers. But if somebody's a little bit older, they might not have ever been on the internet or have worked with computers. So thank you for doing such public service there and teaching some of our members how to work with that. We call that the digital divide. We talk about digital natives, people that grew up with computers, the kids with their phones, and then digital immigrants. So people that it's something that they're just learning. So I commend you guys for getting that grant with Microsoft and being able to distribute those laptops with to our colleagues, to the job seekers. So I know we've discussed a lot of different topics. Is there anything that you would want to add?
Well, we have a December. We have a December to end the grant, but maybe hopefully for the next year we come to other grant, and hopefully we have fundings to give more capacitation for the people.
Are you guys at other public events giving out information about EP Heat? Are there plans for other events in the near future?
What we're trying to do is try to implement some workshops with the Microsoft basic computer skills. And I'm talking about topics about health, like diabetes, COVID-19, and we invite mostly the community that we already have for the Microsoft tutoring classes, but it's open to all the community in case that they want to come and take advantage of the workshops.
There could be people watching that might want to consider a career in community health. What advice would you give them? Ms. Laura, you've been doing this for almost 20 years now then. And so are you happy with your career choice? What would you tell somebody that's thinking of going into community health? Or Ms. Karina, I think you mentioned you've also been working since the early 2000s. So you're also almost at 20 years, although you both look really young. So, you know, you must have been very young when you started. You know, what advice would you give somebody going into community health or wanting to study that as a field?
Well, I only think that this career is a vocation. If would you like to help the community, if is the passion help educating the community, this is the career that you need to take, because it's very important that you make your work with passion, with love, always for the people.
That's wonderful advice. Ms. Laura, anything to add?
Well, like Karina is telling you, I will recommend this career for people or for a person that wants or likes to help people, because a promotora, it's like one of my other co-workers, she say in Spanish, that being a community health worker is like the bridge for the community, because we need to connect the people from the community to social services, and we also educate them about health information. So I would recommend that for the people that want to help and do or make a difference in the community.
No, that's great advice. And I think, you know, there's a saying that nobody's a prophet in their own land. And so I think sometimes in our community, you know, people don't have health insurance, or they wait till they're really sick to go to the emergency room. And so thank you for trying to be there for them ahead of time before the situation gets really bad, and provide them advice, because both of you look like, you know, somebody that I would trust, and that, you know, seem to have our best interest in mind. So thank you for being that bridge, and thank you for being a part of Texas Tech. We're almost at the end of our show, so I want to thank both of our guests, Ms. Laura Renovato and Ms. Karina Becerra, promotoras at Texas Tech Health Science Center. You will, in the future, maybe you will see them doing community events, or if you're interested in their work, we'll provide their contact information at the end. Thank you.
Thank you.
Thank you for the opportunity.